Your body has an incredible way of communicating to you what's going on inside it. For example, if bacteria or viruses attack your body, it tells you by causing a fever while it's fighting the infection. When your body is bothered by pollen, pollution, or fur, it tells you by causing you to sneeze, an allergic reaction. And when there's something toxic in your diet, your gut tries to throw it out by causing you to vomit. Some of the changes are perfectly normal and a part of our body's defense mechanism, while some signs may indicate some serious underlying health issues that you should never ignore. So in today's video, let's learn about some of the most important and noticeable changes in your body that you should never ignore. Recognizing these warning signs will help you get the medical attention you need and avoid any complications associated with them. Without any further delay, let's begin. Sign number 1 is experiencing unexplained weight loss. If you are overweight, weight loss might sound like a pleasant surprise, but it's really important to understand that it can be a red flag for underlying health issues, especially when you start losing weight even without any intentional changes to your diet or activity level. There are many reasons for unexplained weight loss, including stress, changes in metabolism, and some more serious causes. For example, an overactive thyroid can speed up your metabolism, causing rapid weight loss. Similarly, certain cancers, such as pancreatic or lung cancer, can show up with unexplained weight loss as an early warning sign. Certain digestive problems like celiac disease or Crohn's disease can interfere with nutrient absorption and lead to weight loss. The key takeaway here is that unexplained weight loss should not be ignored. If you notice a significant drop in your weight without any apparent reason, it's essential to consult a healthcare professional. Remember, early detection of potential health issues is always better for your overall health. Before we move on, please take a moment to subscribe to the channel and hit the bell icon. If you find our videos helpful, please support us by becoming a patron. Moving on to sign number 2, persistent fatigue. You know that feeling when you're just super tired all the time, even after a full night's sleep? Well, that's what we call persistent fatigue. Now here's the thing. Feeling tired occasionally is normal, especially if you've had a busy day or a rough night's sleep. But when this tiredness sticks around for days or weeks, that's when it's trying to tell you something. For example, anemia is a condition when you don't have enough healthy red blood cells. Red blood cells basically act as carriers of oxygen, without which your body won't be able to produce energy and work properly. Eventually, this can cause you to have low energy, feeling tired even without working, numbness or tingling in your hands or feet, and sometimes even dizziness and headaches. Similarly, thyroid problems can seriously disturb your metabolism, reducing your body's ability to produce energy and making you feel constantly tired. Persistent fatigue can also happen for not getting enough sleep, dealing with stress, or not eating right. So when you notice this kind of long-lasting fatigue, you should take it as a signal from your body and reach out to a doctor. Sign number 3. Unexplained changes in bowel movements. Your bowel movements can actually reveal quite a bit about your health. The key thing to look out for here is a sudden change. For example, if you are suffering from constipation but have a long history of the condition, you don't have to rush to the emergency room just yet. However, if the condition comes suddenly with vomiting, nausea, or abdominal pain, you should seek immediate medical attention. Similarly, if diarrhea isn't not going away despite medication, or it shows up with blood in your stools, or your stools are getting black or tarry, then you need to consult your doctor. These sudden changes can be due to many factors, from diet and stress to more serious issues like irritable bowel syndrome, gut infections, or even colorectal problems. So if you notice anything unusual in your bathroom visits, don't hesitate to reach out to a healthcare professional. They can help you figure out what's going on and how to keep your digestive system in check. Now let's move to sign number 4, changes in your nails. You see, your nails can give you hints about your health. If you look at your nails and you notice something different like spots, lines, or abnormal changes in their color, then just don't ignore them. For example, if you notice that your nails are changing shape and getting thicker and wider, it is also called nail clubbing. Well, it's not a disease on its own, but it may indicate some serious issues with your lungs or heart. and sometimes it is due to problems in the intestines, liver, or thyroid. Nail clubbing isn't normal, and it's a sign that there might be something serious happening in your body. So, if you spot this nail clubbing thing, it's time to talk to your doctor for a thorough checkup. Similarly, if you see your nails turning yellowish or brown, it might be a sign of a fungal infection. But it's not just about infections. Your nails can also change their color or appearance if you're not getting enough of certain vitamins or minerals. Especially if they're getting brittle or have ridges, it could mean you need to eat foods with more nutrients like zinc, iron, biotin or vitamin B7, vitamin C, and omega-3 fatty acids. These nutrients are important for your cellular functions, your metabolism, your immune system, your red blood cells, and the structural integrity of your nails, hair, and skin. Sign number 5. Feeling full after eating very little. You know that feeling when you start eating, but after just a few bites, your tummy tells you it's full, even though you haven't had much? Well, normally your stomach can handle a good amount of food before making you feel full. But if you're getting that full feeling much faster than usual, it could mean that your stomach is irritated, your hunger hormones are disturbed, or you might have small sores in your stomach lining called ulcers. Ghrelin and leptin are two hormones mainly related to hunger. Ghrelin makes you feel hungry, and leptin makes you feel full after you eat. However, certain health conditions can mess with the balance of these hormones. For example, obesity or weight gain can cause high levels of leptin in your body, making you feel full after eating less than usual. Similarly, insufficient levels of ghrelin are likely to suppress your feelings of hunger. Taking too much stress can seriously mess with the balance of these hormones and your overall gut health. So, if you're frequently feeling too full too soon, it's important to have a chat with a healthcare expert. Moving to sign number 6, sudden vision changes. Eyes are like windows to the world, allowing us to see and experience everything around us. But sudden vision changes or changes in the color of your eyes can be alarming signs that you shouldn't ignore. For example, if you notice yellowing of the whites of your eyes, it could be a sign of liver problems, or jaundice to be specific. Redness and itchiness often indicate allergies and eye infections. Additionally, blurred vision or sudden vision changes may be associated with more serious conditions, including type 2 diabetes, high blood pressure, age-related macular degeneration, glaucoma, or cataracts. So if you notice any sudden vision changes, get this checked out by an eye doctor. Lastly, on number 7, frequent urination. You see, your bladder is like a storage tank for urine, and it's controlled by muscles. Normally, it should hold on to that urine until you decide it's time to let go of urine. But if you find yourself making pit stops every hour or even more frequently, it could be a sign of a urinary tract infection, where tiny germs are causing trouble in your bladder or urinary duct. In some cases, frequent urination can also be a sign of diabetes, where your body is trying to get rid of extra sugar by flushing it out through your urine. So, if you're making more bathroom runs than you're used to, don't just brush it off. Chat with a healthcare professional to get things checked out and sorted. Thank you for watching and subscribing to the channel. See you in the next video.